So over the past 2 days, you've had several opportunities to engage with your devices in terms of answering questions via SMS. One of the interesting things you may not know is the research now shows that we are actually engaging with these devices every 6 minutes. That's a lot. It's ingrained in our everyday lives. We're using it, personal work. It's something that we all do. But ironically, there's a big push now to disconnect. When you think about some of the things that are in the research and in the literature around disconnecting, I saw a comic come through my desk yesterday that actually depicted a family sitting around a table having dinner, and the mother's caption said, "Would you please pass the charging cable?" And I thought that was funny because I've got 2 teenage boys that I can relate to. I'm constantly telling them, put the phone down, don't look at your device before you go to bed. Please look at me when I'm talking to you, but it's still the easiest way for me to communicate with them. I get responses. You still get one-word responses, but at least you get responses and they're time-stamped. So there's a desire to disconnect in this connected world. And so it just shows there's an innate desire in all of us to still have that traditional form of communication. So when I was first talking about this presentation with Mapi, we do a lot of work with them on the ePro and the ECOA side, working quite a bit towards patient engagement, collaborative initiatives. And one of the things that was hard for me is I preach every day about a company that spent the past 10 years developing a mobile platform focused towards BYOD in a global footprint. But here today we're going to talk about a little bit different. We're going to kind of bring us back old school with some paper. And I think the key here is when you're looking at a patient-centered approach, it's understanding that while we are connected, there still is that desire for some traditional forms of communication. So that is the advantage of having a good partnership, is that you're able to bounce ideas back and forth and really get an idea of what makes sense for the particular study that you are approaching. I'm putting some statistics up here. This is nothing new. Lily had a fantastic banner stand earlier today talking about enrollment issues, the fact that folks will sign an informed consent and then never finish the protocol. These are all things that we know are issues. That's why we're in this room. That's why you've got an exhibit hall full of great vendors out there with solutions that can solve some of these issues. We also know, as I mentioned in my intro, that we're accessing this device 150 times a day. We know that internet in the developing world is increasing about 2 times as fast as the developed countries, and we also know that we're now at a 97% saturation in terms of mobile devices. So that's a good portion of the world. We also know that the smartphone has finally tipped the scale, and we're able to do so much more with our devices. I saw in the news this morning that the co-founder of Uber, who's since left, launched a new company called Pager, which allows you to now immediately click and access a doctor, real time. You immediately have an interaction with the physician where you can have a video teleconference, and then they decide if you need to come in for a visit or if they can treat you over the phone. And then it's all paid through your Apple Pay. So doing so much with our devices. But what we're going to talk about now is, in all of this, there is a period in time when the amount of disruptive innovation really needs to match the protocol, what your objectives are, really what you're trying to accomplish. And that includes bringing a mix of some of the older ways to do things. So.
I have my piece of paper, my old technology. Hello, I'm Jeanne-Luc Michel. I'm the director for our direct-to-patient contact unit within Mapi Real-World Evidence. I'm based out in France, as you can guess from my accent. When we were discussing this presentation with Jeremy, Jeremy showed me this picture that we have actually already seen yesterday. And I mean, of course, it's a mobile word, it's a technology word, and this is just obvious from the pictures we have here. The behaviors have changed, the access to the information have changed. Now, the way I see it, I've been working with direct-to-patient contacts within the last 8 years now. The way I see it is that we have this crowd there, and they want to live the moment. They do have their device with them, but they still want to be there. So there is certainly something we need to understand behind that. And I'm sure the question is what all these people around this place will do with their pictures and videos. And there is probably not just one answer to that. There are probably some of them who have posted immediately on their Facebook page the picture. Others may just probably bring back home and print maybe a picture, and others maybe have completely messed up and just have their memory and bring this back home. And I think what I wanted to discuss with you today was really that patient-centered strategies cannot rely only on what we think will be the right message and the right method, and we really need to understand who are the patients. And I think this conversation fits very well with the latest discussions we had today. So what we want to do is really to understand who is behind the patient. And I read Hippocrates said it's more important to understand which kind of person has a disease rather than what kind of disease a person has. And this is really where we are coming from when we work on those direct-to-patient contact solutions, and we discuss with sponsors about the best strategies. Because, I mean, just look around your own family and think about your own environment. Just taking the examples of my parents, for example, they have the same age, 70 years old, they live together, they share the same hobbies, and still they are just very different individuals. My father is very technology driven, and he would be, I think, the perfect candidate for most of the very nice technologies and tools that were presented during this conference. On the other side, there is my mother, and she's somehow reluctant, or at least not very interested in those technology. She does have a phone safely in her bag, just in case she would need it. I think a nap for her is probably what she thinks she's taking after lunch when she's tired. I don't want to be nasty with her. Also thinking about my cousin, 24 years old, don't want to be nasty either, but I'm not sure he knows exactly how to write an address on an envelope. And completing a paper questionnaire would certainly be burdensome, or I don't think we will engage him very much using this kind of methods. So I think what we all want to achieve here is really collect the right data, quality data, to make sure that we have robust results, and we can respond to requirements from authorities, or to make decisions, strategic decisions for marketing, product, pharmacovigilance, etc. This is also particularly interesting in the late phase environment, which is what I'm mainly coming from, and we are working within Mapi. Because you really don't want to bias your sample with engaging through a technology that maybe many people or some people will not adhere to. So you would rather want to make sure that you send the right message at the right time and with using the right method. And a great thing in observational post-marketing studies are really about how representative your patient population is, and you don't really want to introduce a bias with a specific tool here. However, it's still crucial for us to follow those trends and the technologies. I'm not saying that we should not do that at all. It's something we do have to do, but we also have to understand this whole process and who is the patient and what will they want. So we really have this thought process, and I would say even a risk management assessment for each trial, because I think each trial, each condition is of course unique. You learn from your experience, but you need to understand all this. So I think you just need to be prepared, to be flexible on the type of methods you use to collect your data. And I think it would be probably detrimental to a trial to stick to just one action plan. And this is really where our collaboration comes from, because we don't want to compete with each other. Instead, we think that we can bring something together and really challenge ourselves and bring tools and ideas and more tools for our studies. I wanted to share also one study and lessons learned, of course, that was conducted a few years ago, and I definitely understand that this have evolved and will evolve. This was a study that we conducted in 4 EU Nordic countries, and it was in HPV, involving more than 40,000 patients. That was sponsored mainly by the local cancer registries, and the purpose of the study was to collect some epidemiology data from women aged 18 to 45. We've decided to implement a multi-modal approach in the data collection process. So because we wanted to make sure that we were collecting as many data as we could from this population, and definitely this we thought that the web option would be the most widely used, and that was a valid assumption at that time, because I mean those countries are perfectly used web. They have access. It's quite a homogeneous, I would say, region. So we thought it would be somehow we wouldn't have so many differences. And we also had escalated steps to optimize response rates, meaning that we were reminding and suggesting alternative strategies or methods. They could choose paper, online, phone, and again we thought web would be the most appropriate tool. And as you can probably see here, the dark blue percentages are this super exciting percentage of paper use. And when we really want to have paperless studies, etc., that was kind of frightening, I would say. When we were preparing for this presentation with Jeremy, I can maybe say that Jerry was kind of a little freaking out that we cannot really promote paper in this conference. And this is really not what I'm saying here. This is not my purpose either, but if it's beneficial to the outcomes of the project, and this is what actually people choose because they were comfortable with that, then we have to deal with that, and it's probably a good option too. I just wonder what would have happened if we had proposed only one method of communication. If it was only web, I think maybe we would have ended up with certainly less response rates and maybe more withdrawals. That's of course an assumption. This is very important to keep in mind as well when we run global studies, because from one region to another, from one country to another, access to those methods may vary a lot, and preferences are really what we should look for the future too. Even though it might be a little probably burdensome for us to handle these different sources of information, we were still able, I reassure you about this, that we have concentrated everything on the same platform. So even though it was a phone interview or a web questionnaire or paper questionnaire, this was all transferred and collected within the same database. So I'm just really sharing here thoughts and real experience with real people today. And the idea here is really to show that these combined approaches and flexible approaches, they do have a good return on investment. I'm sharing here some results and metrics that we have gathered from more than 40 projects, including direct-to-patient contact strategies. And really the return on investment is this one, the compliance rate, the retention rate, acceptance to participate, high percentages, the successful contacts, whatever the method is, and then the different data collection rate, whether it is phone or paper or electronic. And I mean, we have talked a lot during this conference about new technologies, new tools, etc. And this is definitely what we are moving toward. But I think we're probably still in a transition phase, and this is where we are we can complement each other too, from our different expertise, experience, because what we want to achieve again is to make sure that we get those robust results. So maybe you find this a little outdated or disruptive, but again, this is really coming from experience and insights and from our patients. Also keep in mind that when you use quality of life instruments, validated instruments, again, this is still a work in progress because not everything is validated for an electronic data capture. So this is ongoing, and this is also where our collaboration comes from between Exco and Mapi with our language services to validate that all these data can be integrated in those different e-solutions, I would say. Again, it's just using our common sense when we discuss strategies with our sponsors. There is obviously an increasing demand from the industry, from the sponsors to introduce new technologies. And this is definitely, again, what we have to do. But we definitely need to understand what our patients' preferences are, and really good innovation should really be patient and results focused. And this is what we're trying to achieve. So I would say probably that as a conclusion that our innovation is really this flexibility and combined approach and working together rather than competing with each other.
Yeah, I would also add to that I mean, this is a late phase program with 10,000 patients, so you've got a lot of flexibility in what you can do as opposed to an earlier phase program. So when you design the technology, giving those patients the opportunity to respond in whatever is convenient for them at that particular given time. So you're not siloing them to paper or phone or web or app, but giving them the ability to flow between those different modalities depending upon where they are and what they're doing at that given time when things need to be done. So there's a lot of things you can do on the technology side to really, again, accommodate those patients where they are so that we achieve those end results.
And maybe I just have a very last comment that maybe with our smartphones will be the future paper-like participants in the future. We don't know, maybe. Thank you.
Thank you.